In this video, we're going to be talking about tissue trauma and how to avoid it. So I'm going to be giving my tips on how to avoid it, so let's talk about it. Tip number one is it falls back to the basics, which is adaptation and angulation. Now, if you incorrectly angle or adapt to the tooth wrong, of course the instrument isn't made for that, so you're going to be causing tissue trauma. Now, I did make a video on that, so go check that out if you want to get more detailed look into adaptation and angulation of an instrument. Tip number two, and I think it's very, very underrated, patient positioning. Remember, you're the hygienist. You're literally the clinician. You can move your patient however you want because you're trying to provide the best quality care for them. Now, of course, there are patients who are exceptions, but for the most part, you're in control. Make sure to move the patient however it's best in order not to cause tissue trauma. Tip number three, and I know it sounds funny, but it's sharp instruments. You're not using the sharp instruments to cut tissue, unless you're curetaging. But anyways, that's besides the point. Sharp instruments are going to give you the best quality for your scaler. You're going to be able to remove calc or plaque easier than if it was dual. And if it was a dual instrument, then you're going to slip. And you don't want to slip because guess what? You're going to cause tissue trauma. Lastly, have a steady fulcrum. Because if you have a steady fulcrum, you're less likely to slip up and cut the patient. I'm pretty sure there's other tips out there that will help avoid tissue trauma, but to me, these are the most important ones, so I hope that helps.